COVID-19 has resulted in at least 4.3 million deaths worldwide and global economic contraction. China is not the only country that has managed to control the first wave of the epidemic and reach a COVID-free status, yet it is the only country in the world to have avoided subsequent uncontrolled outbreaks. This is according to Carole Gabay, an expat living in Shanghai who has been tracking COVID numbers from China and abroad since the outbreak in Wuhan. What do data tell her? What is there a gap between outside perception and reality on the ground? Earlier, I talked to Carole Gabay herself, analytics lead of Solidarity COVID Association, a non-governmental association dedicated to COVID-19 analysis for the expat community in China. I started by asking her what kind of data she was collecting and why it was important for her.
We started in January 2020 to collect data and inform the French community, which was totally in panic at that time. And since then, things have changed a lot. Of course, in China, everything is under control. Now, our objective as a non-governmental association is to maintain and curate exclusive data sets and analytical tools that help increase the knowledge and the understanding of the dynamics of the pandemic, with a specific perspective of the French expat community in China, which is hardly affected by the travel ban, the shortage and the suspension of flights, and the misaligned vaccination policies across China and Europe. So we collect epidemics KPIs on China, France and the world, but we focus on a few exclusivities that other observers do not curate in such detail. So for China, as I explained last time in January, we have the confirmed cases, but eventually when the asymptomatic came out, we collect also the asymptomatic, the severe cases by prefecture every day, the demographics of cases, local cases when it's available, and for the imported cases, the origin, the country of origin, and that gives us a very exclusive data set, which is, I think, a world exclusivity for a non-governmental organization, and it requires us several hours of work every day, including weekends, and we need to do the work every day, as some elements do not stay on the apps after 24 hours.
Where do you get your data? Where do you get these numbers? Are they all from open sources platforms?
So it's apps, website, Baidu, Sina, Taotiao, everything all in Chinese. I have a Chinese lady who helps me, so we are a team of volunteers.
How do you make sure that the data, at least, is accurate and objective? For instance, you might have sites that are overlapping. I don't know. Maybe you have numbers.
So you mean for China data?
Yeah, for the Chinese data, how do you make sure that it's accurate, it's not double calculated or missed out?
We have all the back data. We have all the back data day by day. So if I see some negative cases, that means I made a mistake in the in the collection. So and then we can keep consistency. If we have big spikes, you know, it shows up. So in terms of consistency of the data, it makes sense. And I have some graphs showing, you know, the local clusters from day one to last day, and usually for China, it's no more than 35 days, the clusters. Even the Nanjing cluster, I thought it would last longer because it's spread out, but it looks like it's under control by the end of the week.
So tell us, what are some of the results? For instance, what do the data reveal that you didn't already know, let's say, about the number of cases, the trends of COVID-19 in China? And is the discrepancy very big between what you have calculated and what, for instance, has been given by the Chinese authorities? Just out of curiosity, how do the numbers compare?
No, it's the same numbers given by the Chinese authorities, but what I notice is that the WHO and all the international reports, the platforms we use that use global data like Johns Hopkins, Our World in Data, Worldometer, they only collect the confirmed cases. And the more, because now there's massive testing in China, or whenever there are cases, you can hardly miss a case. You get massive testing every
Yes.
2 to 3 days, and some of them come out asymptomatic. It depends on the city and so on.
Yeah.
So if you don't track the asymptomatic, specifically on the imported cases, there's a lot of asymptomatic cases that are detected, and not all of them convert to confirmed later. Depends on the province. That's another story. It's very important to keep track of the overall picture.
What do you make of China's response to COVID-19 and the difference between China's reactions, China's response versus that of many other countries?
So as you said, China is the only country that managed to, after the first wave, to keep the numbers insignificantly low in terms of local cases. So
Yeah.
that's why it's also important to split local and imported. In terms of local cases, when there are major clusters, like what we call major clusters, like the Nanjing cluster, which spread out in 10 provinces, we still have very low numbers at country level and even at city level. So if you take the largest subcluster, which is Yangzhou, which is also the most concerning one because it started with elderly people.
Yeah.
We have a peak incidence of 31 per day cases for 1 million population, which I compare with another low epidemic zone, which is Singapore, 27 in the peak of July. But the difference, so yeah, there's 4 points difference, but the difference is like Yangzhou is a 1.5 million population, Singapore is like 7 million, and Singapore, it's been going on since mid-April. So that means with all the restrictions that come along that the Singapore people are dealing with on a daily basis. So the response for China has made our freedom of all of us, all the residents of China, much higher.
Carole Gabay, Analytics Lead of the Solidarity COVID Association. With that, we come to the end of this edition of The Point, with me, Li-Xin, coming to you from Beijing. Follow me on Facebook and Twitter using the handle Li-Xin in Beijing. Thanks for watching. We've got The Point.